What were the specific criticisms of the police investigation into Harold Shipman? When we think about the tragic case of Harold Shipman, we often wonder how he managed to evade justice for so long. The police investigation into his actions faced numerous criticisms that highlight serious flaws. Let's break down what went wrong during this critical inquiry. First, the lead detective inspector assigned to the case was seen as inexperienced. Many described him as being out of his depth. This lack of experience led to several mistakes that could have been avoided. He did not properly supervise the investigation or escalate concerns to senior officers who could have taken stronger action. Next, the investigation failed to make basic inquiries that are standard in any criminal case. For instance, the police did not check Shipman's criminal record, which included previous drug offenses. This oversight represented a major lapse in police procedure. There was also poor supervision and reporting throughout the investigation. A senior officer who reviewed the case report excused the lead detective's errors. This lack of critical assessment allowed the inquiry to close prematurely, missing the full extent of Shipman's crimes. Another significant issue was the reluctance of investigators and medical advisors to consider the possibility that Shipman was deliberately killing patients. This cognitive bias led to a lack of objective examination of the evidence. Because of this, opportunities to stop him earlier were missed. The investigation was further hampered by a flawed system of death certification. It relied heavily on the honesty of Shipman himself. This meant that suspicious deaths were not properly scrutinized by external authorities, allowing him to continue his actions unchecked. Due to these failures, Shipman was able to kill at least 3 more patients even after suspicions had been raised. The delay between initial concerns and his eventual arrest allowed further murders to occur, which could have been prevented. Lastly, a medical advisor who reviewed patient records was compromised by his personal acquaintance with Shipman. This connection affected his objectivity and weakened the case against Shipman. In summary, the police investigation into Harold Shipman was marked by inadequate leadership, failure to follow basic investigative procedures, and poor interagency communication. These factors combined allowed Shipman's crimes to remain as undetected for an extended period, resulting in many preventable deaths. This case serves as a reminder of the importance of rigorous police training and objective inquiry in preventing serial killings within healthcare settings.